Now I'm going to discuss about techniques and strategies of CBT. Identifying and challenging negative thoughts. CBT is a type of therapy that can help individuals identify and challenging negative thoughts that contribute to emotional distress. There are some steps that can help in identifying and challenging negative thoughts. Number one, identify the negative thought. The first step is to become aware of the negative thought that is causing distress. It can be helpful to write down the thought to gain clarity. Number second, evaluate the evidence. Once negative thought is identified, evaluate the evidence that supports and contradicts the thought. Alternative perspective. Consider alternative perspectives that are more balanced and realistic that can involve identifying positive aspects of the situation or thinking about how might view the situation, how others might view the situation. Test the thought. Test the validity of the negative thought by examining the evidence for and against it. This can involve asking questions such as, in this thought based on fact or assumption, or what is the worst case scenario? How likely is it to occur? Some more, if you want to know some more techniques, you can also visit this link and get some more information about that. Now, coming towards the next thing, cognitive restructuring. It is a technique that has been successfully used to help people change the way they think. When used for stress management, the goal is to replace stress producing thoughts with more balancing thoughts that do not put stress. When negative patterns become destructive and self defeating, it's a good idea to explore ways to interrupt and redirect them. That's what cognitive reconstruction do, restructuring do. How does cognitive restructuring work? It is the heart of CBT, a well-studied talk therapy approach that can be effective at treating any medical mental health conditions, including depression, anxiety, and disorders. In CBT, a patient and therapist will work together to identify thoughts patterns that are contributing to a problem and practice techniques to help reshape negative thought patterns. It can be tricky to recognize inaccuracies in your own thought patterns. As the name suggests, cognitive restructuring techniques deconstruct unhelpful thoughts and rebuild them in a more balanced and accurate way. People sometimes experience cognitive distortions that through patterns that create a distorted, unhealthy view of reality. What type of issues can cognitive restructuring help with? Like it can help with eating disorders, depression, anxiety, mental illness, and marital problems. Behavioral activation. It is an approach to mental health that involves someone using behavior to influence their emotional state. It is often part of cognition behavioral theory therapy, but it can also be a standalone treatment. Most research into behavioral activation has focused on its activation on depression. From a chemical perspective, engaging in rewarding activities can increase the release of certain neurotransmitters in the brain, such as dopamine, serotonin. These neurotransmitters are involved in the regulation of mood behaviors that can lead to feeling of happiness and well-being. Additionally, behavior activation can help to break the cycle of avoidance, negative thinking that contribute to anxiety. Overall, the chemical changes that occur as a result of engaging in rewarding activities, though behavioral activation can also be used to promote positive emotions and reduce negative emotions, including anxiety. Exposure techniques. In this form, psychologists create a safe environment in which to expose individuals to things they fear and avoid. From a chemical perspective, exposure therapy can help reduce anxiety, fear of activating, and the fear of extinction learning process in the brain. Fear extinction learning involves the process of learning that a previously feared stimulus or a situation is no longer threatening. Relaxation techniques. It's a method used to help reduce muscle tension and stress, lower blood pressure, and control the pain. Examples of relaxation techniques include tensing and relaxing muscles throughout the body. Breathe focus. In this simple, powerful technique, you take a long, slow, deep breaths. As you breathe, you gently disengage your mind from distracting thoughts and sensations. Slow diaphragmatic breathing is one relaxation skill used in CBT. It is best used as a daily practice like exercise or as a way to get through a tough situation without living or making things worse. For best results, practice slow breathing twice a day for around 10 minutes each time. Applications of CBT. For people with anxiety disorders, negative ways of thinking, uh, fuel the negative emotions of anxiety or fear. The goal of CBT for anxiety is to identify and correct these negative thoughts and beliefs. Eating disorder. CBT is an evidence-based psychotherapy approach can be used effectively to treat eating disorders such as uh, anorexia nervosa and like some other as well. CBT for eating disorders typically involves combination or techniques aimed at changing the distorted thoughts. Some examples of how CBT can help in eating disorders are in the restructuring process. This technique involves identifying and challenging negative thoughts and beliefs related to body damage, food, and weight. In behavioral experiment, the technique involved testing out new behaviors and thoughts related to that food. Exposure therapy. This technique involves gradually exposing individual to fear, food, or situations related to food and eating. Mindfulness-based intervention. This technique involves learning to focus on attention on the present moment without judgment. Family-based intervention. These techniques involving the family in treatment, particularly for adolescents with eating disorders. Here are some links that I have provided here for more in-depth knowledge about this topic. Evidence-based research on CBT. There have been several studies that have found CBT to be more effective than other therapies for a variety of mental health disorders. While these studies may not directly relate to chemistry, they do not offer insight into the effectiveness of CBT compared to other treatments. Here are a few examples of that. A study published in the Journal of Psychiatric Research compared the effectiveness of CBT supportive therapy in treating individuals with panic disorders. Another study published in the Journal of Consulting and Clinical Psychology compared the effectiveness of CBT psychodynamic therapy. Psychodynamic therapy is basically exposure to exploring of unconscious thoughts and treat them. In treating individuals with major depressive disorders. A review of multiple studies published in the Journal of Clinical Psychology review found that CBT was more effective than other therapies in treating a variety of anxiety disorders, including social anxiety disorder, generalized anxiety disorder, and post-traumatic stress disorders. Overall, these studies suggest that CBT may be more effective than other therapies in treating certain mental health disorders, while the specific chemistry behind CBT's effectiveness is not fully understood. It is believed to be related to changes in neurotransmitters activity and brain function that result from the cognitive and behavioral techniques used in this therapy. Here are some sources for the information I have provided. Actually, these are some articles and books that from where I have taken this information from. Advancements in CBT. Like the world is moving toward the technology, and it is an era of technology where everything has been automated. Similarly, in the field of medical and therapies, these advancements have been implemented, and technology has played an increasingly significant role in delivering of CBT. In recent years, it has explained the reach and accessibility of CBT. Online CBT programs, online platforms, applications offer self-guided CBT like AI chatbots, which are quite famous nowadays. These programs often include interactive exercise educational materials and tracking tools to support using in applying CBT techniques to manage their mental health. Teletherapy involves conducting therapy sessions remotely using video conferencing tools. Mobile apps. There is a wide range of mobile applications available that provide activity-based interventions and support. These apps often include features such as mood tracking, or journaling, guiding meditations, etc. Integration of neuroscience and CBT. CBT is a widely used psychological therapy that focuses on identifying and modifying unhelpful thoughts and behaviors. The chemical aspect of this integration refers to the neurotransmitters and their role in cognition, emotion, and behavior. Neurotransmitters are chemical messengers in the brain that transmit signals within the cell that play a crucial role in various aspects of mental. In the context of CBT, the integration with neuroscience involves exploring how thought and behaviors influence neurotransmitters activity and vice versa. For example, negative thought patterns and stress can affect neurotransmitter levels. These cognitive and behavioral factors uh, through CBT technique, it is believed that the chemical process in the brain can be positively influenced, promoting under mental health outcomes. Coming towards the last topic of my presentation, what is the conclusion of this whole presentation? Like we started from the definition of CBT, then we discuss its history, then discuss the transmitters that are involved in normal functioning of the body or when those neurotransmitters are lower than average, like what are their uh, what are the diseases linked with the lower level of those neurotransmitters, or what are the diseases linked with the higher level of neurotransmitters. And after that, we have also discussed about their how to increase and how to maintain those neurotransmitters, and we have also studied about the medicinal treatment of uh, neurotransmitters deficiencies or excessiveness as well. After that, we have studied about the applications that we are using in CBT in modern era, and now moving towards the last topic. That is the conclusion of this whole journey of this presentation. Conclusion. CBT has been widely studied and shown to be effective in treating a range of mental health conditions. Strengths of CBT. Its supposedly has been extensively researched and has a robust evidence base supporting its effectiveness in treating various disorders. Active and collaborative approach. CBT is an active form of therapy that focuses on teaching individuals practical skills and strategies to manage their symptoms. And it is always motivated and it is always encouraged that CBT therapy should always be taken for a therapy, not by ourselves. Therapy is never been encouraged from the medical professionals. Targeting underlying cognitive process. CBT addresses the role of thoughts, beliefs, and interpretations in shaping emotions, behavior by identifying and identifying negative and positives through patterns. Limitations of CBT, like everything in this world, there is hardly some things that do not have their limitation. Everything that have advancements certainly have their limitations as well. So the limitations of CBT is reliance on self-report cognitive. CBT heavily relies on self-report measures and individual insights and beliefs. It may not address all underlying factors. CBT primarily focuses on cognitive behavioral aspects and may not fully address all underlying factors contributing to mental health conditions that may not be as effective for individuals with complex or severe psychological disorders that require more comprehensive treatment. It's important to note that the strengths and limitations mentioned above are general observations and may vary depending upon individual circumstance. The specific disorder being treated and the implementation of CBT by therapists. Here are some sources supporting the strengths and limitations of CBT mentioned above. Actually, these are some books from where I have um, some books and some articles from where I have picked up some limitations and strengths of CBT. You can download these articles in book form, Z Library, an app, and sorry, it's an online site, Z Library, from where you can download books and articles for free, and you will learn about them as well. The incorporation of CBT into the border healthcare system is of significant importance for several reasons. Efficacy. CBT has extensively researched and proven to be highly effective in treating a wide range of medical conditions, including anxiety disorder, depression, demotivation, self-esteem, low confidence, low self-esteem, etc. Holistic approach by incorporating CBT into the border healthcare system, a more holistic approach to patient can be achieved. Mental health is closely intertwined with physical health. If a person has a good mental health, uh, it is highly possible that the person is also enjoying a good physical health as well. And addressing psychological factors can improve overall well-being. Integrating CBT with other medical treatments can lead to better outcomes for patients. Preventions and early interventions. CBT is not effective for treating existing mental health conditions, but can also be utilized for prevention and early interventions. By incorporating CBT techniques into routine healthcare practices, healthcare providers can identify and address early signs of distress or risk factors for mental health issues. This proactive approach can help prevent the development of more severe conditions and promote early recovery. Cost effectiveness. CBT has demonstrated cost effectiveness in comparison to other forms of treatment. Like if we talk about medication, they might be costly, but CBT it is a conversation with the therapist and that promote positive attitude and positive thinking in the person facing mental issues. In conclusion, incorporating CBT into the border healthcare system is crucial for improving patient outcome, addressing mental health issues comprehensively, enhancing accessibility to mental health services, and promoting a more holistic approach to healthcare. By integrating CBT into routine healthcare practices, we can pave the way for a more effective and efficient healthcare systems that prioritize mental health alongside physical health. So this is all what I want to discuss with the listeners today. And if anybody have any kind of queries, uh, they can search for the particular information from the internet, or still facing, or if there is some kind of contradiction between what I have written and what it is mentioned in the internet, they can contact us.